fracture with intra-articular involvement associated with a fracture of the midshaft of the left fibula. What type of injury? Pylon fracture. 35 severe blow to the side of his face during an assault, was unable to open his mouth. Facial radiographs. Facial fracture most clearly seen on the submentovertex view. Zygomatic arch fracture. 36 pain and swelling around her distal thigh while exercising. Localis tenderness above her knee. Lyric expansal lesion in the metaphysis of the distal femur surrounded by a very thin rim of cortex. No periosteel reaction. Most likely disease. Aneurysmal bone cyst. 37 3-week history. Persistent pain in his right leg. Temperature of 37.8 degree. Craniograph. Diaphyseal mass in the right femur with overlying cortical erosion and soft tissue swelling. Bone biocinemerous small round blue cells. Tumors. Ewing sarcoma. 38 large lesion in their distal femur. Approach would be most appropriate for bone biopsy. Medial approach. 39 elderly gentleman. 12-month history of back pain. Plain radiographs. Multiple sclerotic lesions scattered throughout the spine. Sites of increased uptake on a TC99 radionuclide bone scan. What primary tumor? Prostate. 40 pain in his knee following a fall. Radiograph. Bone tumor in his patella. Most likely chondroblastoma. 41 arm pain with no history of trauma. Eccentric non-expansal lucent lesion in her proximal humerus. No soft tissue mass or periosteel reaction. MRI. Multiple fluid levels. Aneurysmal bone cyst. 42 suspected giant cell tumor. Most appropriate management. Biopsy. Extended curettage and packing with follow-up x-rays. 43 monostotic fibrous dysplasia affecting his humerus, part of the bone involved. Diaphyseal. 44 osteosarcoma of his proximal tibia. Managed. Wide resection and chemotherapy. 45 leg pain and a suspicious lesion was seen on a radiograph. Bone biopsy showed an osteogenic sarcoma. Most important initial staging investigation. Chest x-ray. 46 right-sided shoulder pain. Reduced range of movement of the shoulder with a palpable mass. AP radiograph. Popcorn. Calcification head of the humerus. Diagnosis. Chondrosarcoma. 47 a 27-year-old female. Scoliosis. Absence of the right pedicle of T9 and a bone scan showed a hot spot at this site. Seat confirmed a lyric expansal lesion with an associated soft tissue mass. Biopsy showed the lesion to be benign slow growth. Osteoblastoma. 48 pain in his thigh for a period of 3 weeks. Worse at night and relieved by aspirin. Radiograph. Small lucent area in the proximal femoral cortex surrounded by sclerosis. Diagnosis. Osteoid osteoma. 49 cyclical vaginal bleeding. 8-month history of hip and ankle pain. Multiple hyperpigmented skin lesions. Cafe au lait spots. Plain radiograph. Several ground glass lesions in the proximal femur and distal tibia. Diagnosis. McCune-Albright syndrome. 50 a painful leg following a fall playing football. Radiograph. A pathological fracture of his femur through a well-defined lytic lesion in the medulla, which was mildly expansal and with a ground glass matrix. Likely diagnosis. Fibrous dysplasia. 51 an 8-year-old boy. Onset of right-sided shoulder pain. A diagraph. Aggressive looking lyric lesion in the metadiaphysis of the proximal humerus. MRI. A circumferential extraosseous extension of the tumor with intermediate signal similar to FAD on T2 weighted images with surrounding MA. Diagnosis. Ewing sarcoma. 2 X-ray subarticular multiloculated lyric lesion in the wrist with minimal expansal modeling centered in the metaphysis. Diagnosis. Giant cell tumor. 53 66-year-old man. 5-month history of back pain. Chest radiograph. Number of lucencies in the vertebral bodies. Bone marrow biocere. Jelly-like material. What cell type is it most likely to contain? Plasma cells. 54 onset of pain in her left ring finger. Radiograph. Solitary well circumscribed round lytic lesion with cortical expansion in the diaphysis of the middle phalanx. No associated soft tissue mass. Diagnosis. Enchondroma. 55 19-year history of knee pain and swelling aggravated by movement. Mildly raised white cell count and raised alkaline phosphatase. Diagnosis. Osteosarcoma. 56 lytic lesion in the metaphysis of his proximal tibia. MRI scan. Well-defined lesion with low signal intensity on both TL and T2 weighted scans. Diagnosis. Giant cell tumor. 57 multiple well-circumscribed radiolucent lesions in the iliac wings of the pelvis and a well-defined punched-out lesion in the left femoral shaft with disuse. Osteopenia. Diagnosis. Multiple myeloma. 58 9-year-old girl. Left hip and knee pain. Well-defined radiolucency was visible in the basicervical region of the left femur measuring 6 mm, and within this lesion there was a smaller dense opacity. Extensive cortical sclerosis was present around the lesion. Diagnosis. Osteoid osteoma. 59 34-year-old man with arm pain. Radiograph. Permeative lesion in his humerus, which was expansile and associated with a soft tissue mass and moderate amount of lamellated periosteel reaction likely cause. Lymphoma of bone. 38-year-old woman presented with neck pain and motor weakness, a mass at C6T2 ependymoma. In which part of the spinal canal is this lesion most likely to have originated? Intramedullary. 61. At what age does a hemangiopericytoma most commonly present? 30 to 40 years. 62. 18-year rib pain, well-defined lesion in her greater trochanter, which was ultimately proven to be a chondroblastoma. Pattern of mineralization is typical. Normal surrounding bone, rings and arcs within lesion. 63. At what age is an eosinophilic granuloma most likely to present? 5 to 10 years. 64. 42-year-old female, abnormality of T12 on CT, polka dot appearance with small areas of sclerosis. What signal is this lesion likely to return? Variable signal on TL weighted images, high signal on T2 weighted images. 65. Tuberculous spondylitis. L1. 66. 12-year-old boy, radiograph metaphyseal lucency with dense surrounding sclerosis with a thin lucent channel extending towards the growth plane. Abrodes abscessos, likely causative organism. Staphylococcus aureus. 67. Absent thumb and hypoplastic radius has also required treatment for asymptomatic arrhythmia and VSD. Diagnosis: Holt-Oram syndrome. 68. 37-year-old female, anterior knee pain, thinning of the cartilage in the patellofemoral joint, but no abnormality in the femorotibial joint. Diagnosis: chondromalacia patella. 69. Shoulder pain, torn part of his rotator cuff. Which muscle was most likely to have been damaged? Supraspinatus. 70. CT of his pelvis, appendicitis, incidental finding of a 7. Monostosis, bone island, in his ilia. Most appropriate follow-up: none. Musculoskeletal and trauma radi.
Question number 36. Annular bone cyst, thin cortex, mild expansion, simple bone cyst, और fluid level जो है annular bone cyst, ठीक है ना आगे जो है fluid level. अगर simple bone cyst में fracture हो तो इसमें fluid level आ जाता है, ठीक है. उसमें history में देंगे आपको. Next है round 2 cells in यूं sarcoma, फिर बाकी आसान है. LD जनरल में है तो prostate met से particular cartilage है तो इसमें chondroblastoma होता है, ठीक है. epiphyses है, particular epiphyses है cartilage to bone to chondroblastoma. मतलब chondro cartilage और blastoma bone है तो cartilage to bone, ठीक है. epiphyses. फिर आगे जाते हैं morphofiber dysplasia तो D for dysplasia, D for diaphysis, ठीक है. sarcoma, ठीक है. एक पेशेंट 68 ईयर के जो पेशेंट है तो sarcoma sarcoma इसमें जो है पॉपकॉर्न का लेजन भी होती है, साइड भी होती है, और सिर्फ एक और लेजन जिसमें पॉपकॉर्न का और फाइबर dysplasia है, ठीक है. और अगर 68 ईयर से ऊपर हो पेशेंट और पॉपकॉर्न का हो तो sarcoma. ये दोबारा ऑस्टियोब्लास्टोमा की सुना गया है. अच्छा सब आर्टिकुलर लेजन हो, जॉइंट सेल ट्यूमर, ठीक है. दो सेल बोथ T1 और T2 हेमोसाइगम की वजह से होती है तो ये जॉइंट सेल ट्यूमर नजर आता है. अच्छा परमेटिव लेजन ह्यूमरस में हो तो ये परमेटिव लेजन लिम्फोमा बोन होता है, ठीक है. एपेंडोमोमा इंट्रामेडुलरी इंट्राड्यूरल मास होती है लेजन में. ये रटा करना ये एजेस हेमांजियोपोइजाइटोमा 20% at 30 to 40 years. ये ज़्यादातर एग्जाम में नहीं आता, बस इवन आएगा, इवन की एज होती है. chondroblastoma की mineralization, ठीक है. रिंग आर्क विदिन लेजन. eosinophilic granuloma EO तो up to 10 years, 5 to 10 years, ठीक है. फिर hemangioma in the bone, ठीक है. ये वेरिएबल ऑन T1 है, हाई ऑन T2 है, ठीक है. याद रखो वेरिएबल T1 वेरिएबल है लेकिन ज़्यादा हाई होता है, लेकिन बस इन ऑप्शन में वेरिएबल से टेस्ट का. absent thumb and hypoplastic radius, Holt-Oram syndrome, ठीक है.